Welcome to Innovate Training. My name is Carol Peugeot, and this is the basics of medical terminology, the language of healthcare. And this is lesson 2. We're going to talk about body planes and sections. Well, what are we going to talk about today? Well, first, upon completion of this lesson, the student should be able to describe the various body planes and cavities and what organs are contained within those cavities. The student should be able to explain the directional terms based on the anatomical position, and I will also explain what the anatomical position is. The student should be able to correctly use medical terminology abbreviations while carefully avoiding terminology and abbreviations no longer approved by the Joint Commission, and we'll explain why. The student should also be able to differentiate between the types of tissues, and we're also going to talk about the difference between the cells, tissues, and organs. Well, let's talk about the healthcare professional. The healthcare professional is going to be surrounded by the language of healthcare, and I talked about this many times. You're going to be surrounded by physicians, nurses, physical therapists, and other types of providers, as well as those in the allied health arena who are responsible for the billing, for the coding, for the administration of those healthcare services. In order to be successful in this arena, you have to be able to, first of all, understand medical terminology language, but you also need to be able to understand the basics of how the human body works. So in this section, we're going to talk about two different things. We're going to talk about anatomy, which is the study of the structure of the body, and we're also going to talk about physiology, which is the study of the function of the organs. And again, this is a medical terminology course, so we're just going to touch on these subjects, but we need to be able to get to and have an understanding of the language or the medical terminology pertaining to these two things, these two areas. Innovate Training also offers an anatomy and physiology course, which we get much more in-depth into these two topics. I do, however, recommend this medical terminology course before you take the anatomy and physiology course. It'll make it much easier for you to understand the concepts and the terminology that we use in that course. Well, the human body is the most efficient and effective machine ever created. The body's systems work together to maintain the function and health of that body. It's quite extensive, and it's quite essential that each system work effectively and efficiently. Okay, when we're referring to body planes, the body cavities, or directional terms such as distal or proximal, we have to use these terms in reference to the anatomical position. This is the starting point for these particular term words that we're going to use. The anatomical position is the body standing facing forward with palms facing front. The feet are facing the front, and when referencing a directional term or place on the body, this is going to be the starting point. And this will become clear as we go through these terms, and you'll understand what we mean by this is the starting point or the reference point. Okay, the first thing we're going to talk about are the body planes. Now, imagine the body is divided into 4 planes. There is the frontal, the transverse, the sagittal, and the midsagittal. And we use these planes to define or to give some reference to where in the body or where on the body a particular maybe surgical procedure or a particular disease process is located. So these planes will be referred to throughout this course and throughout the anatomy physiology course that I mentioned earlier. The first plane I want to talk about is called the frontal plane. This is also called the coronal plane, and it divides the body into the front and the back. It's also known as anterior and posterior, anterior referring to the front, posterior referring to the back. It's also referred to as ventral or dorsal. Ventral referring to the front, dorsal referring to the back. You've heard of a dolphin having a dorsal fin. Well, that's a fin that's on the dolphin's back, so it's a dorsal fin. So dorsal refers to back. Next, there is the transverse plane. This divides the body at the waist into upper and lower divisions. It's also known as superior, which is upper, and inferior, which is lower. So upper and lower. So let's say, for instance, the heart would be located in the superior plane or the upper plane, and the knee would be located in the inferior or lower plane. Okay, the next two planes are the sagittal and mid-sagittal planes. Now, the sagittal plane divides the body into right and left sides. So the right hand would be on the right sagittal plane, and the left hand would be on the left sagittal plane. But in the sagittal plane, or when we're using this reference, the two sides aren't necessarily equal. The mid-sagittal plane divides the body into right and left sides as well, but equally on both sides. And so when referring to the mid-sagittal plane, we're referring to both sides, but it's divided equally within the middle point of the body, or the medial aspect of the body. All right, next let's talk about body cavities. Now, we refer to a cavity just refers to a hollow or empty space. So the body is not a solid structure, as we know, because it has organs and open spaces that contain these organs. The two major body cavities are the dorsal, which contains the brain and the spinal cord, and the ventral, which is further divided into thoracic, mediastinum, and abdominal cavities. And these contain the major organs of the body. Now, this is the diagram of the body cavities as divided into the different sections. And we're going to go over these different sections and what is contained within these sections. And some of these sections are actually shared, such as the abdominal pelvic cavity. These are actually two cavities that don't have a barrier. There's also the thoracic cavity, which is the chest, where the lungs are located. The pericardial cavity, which is where the heart is located. And then again, the abdominal cavity, which the stomach and the organs of the digestive system. And then the pelvic cavity, which contain the organs of the reproductive system. Okay, first we're going to talk about the thoracic cavity. The thoracic cavity is what contains the chest. Thoracic means chest, and subdivides into the mediastinum, which is the cavity in the center of the chest that contains the heart, and the pleural cavity, which contains the lungs. The diaphragm divides the thoracic cavity from the abdominal pelvic cavity. And we're going to talk about the diaphragm a little bit later, but it is a muscle, a sheet-like muscle that transections or is in the transverse plane that divides the upper thoracic cavity from the abdominal pelvic cavity. In this diagram, you can get another view of the diaphragm. It's the sheet-like muscle that's located between the thoracic cavity and the abdominal pelvic cavity, and just below the lungs and the heart. In this next diagram, you can see a lateral view of the body cavities. You can see the cranial cavity, where the brain is located, the spinal cavity, which contains the spinal cord, and that's two sections of the dorsal cavity. So the dorsal cavity is divided into the cranial cavity and the spinal cavity. The ventral cavity contains the thoracic cavity, the abdominal cavity, and the pelvic cavity. And those two cavities together are called the abdominal pelvic cavity. Now, in medical terminology, when we're referring to the abdomen, we refer to two ways. There's two ways we can refer to the abdomen. There's the abdominal quadrants. Now, quad means four. So these are divided into four quadrants. The upper right. Now, this is the patient's right, not yours. So if you are facing the patient, this right is actually going to be on your left. So refer to always the patient's right or the patient's left. So there's the right upper, the left upper, the right lower, and the left lower. These are useful when describing patient symptoms. And they're also useful when talking to the patient because they're easy to remember and easy to refer to. So when the patient is describing symptoms, and let's say the patient describes a symptom in the upper right quadrant, that can differentiate between the lower left. Now, it's not as descriptive as the abdominal regions, which we're going to talk about in the next slide, but it is easier to reference when it refers to patient symptoms. Let's talk about the abdominal regions. Now, this one is a little bit more accurate because it divides the abdomen into 9 regions. There's first the right hypochondriac, the epigastric, the left hypochondriac, the right lumbar, the umbilical, the left lumbar, the right iliac, the hypogastric, and the left iliac. Now again, in this diagram you could see it's divided into 9 sections, just like a tic-tac-toe drawn on the abdomen. The center would be the umbilical region. Below that would be the hypo means below, hypogastric, below the stomach region. There's the upper left hypochondriac and the right hypochondriac. There's the right lumbar, referring to the lower back. There's the left lumbar region, the right iliac region, and the left iliac region. So these are ways of describing where on the abdomen that's a little bit more accurate, a little bit more specific than the quadrants. But again, it's a little bit more difficult for a patient to refer to these regions. Now let's talk about medial and lateral. Medial refers to towards the middle or going in the direction of the middle. Lateral means towards the side or outside of the body. So when we say that it's medial, we're referring to it's going towards the center. So towards the center would be the center line that divides the right and left regions of the body. Again, as we mentioned earlier, anterior refers to the front. Posterior refers to the back. So if I was describing a pain on the front abdomen, I would say it is in the anterior region of the body as opposed to the posterior, which would be the back. Next we have superior, which means above, and inferior, meaning below. Now these are reference points, so they could refer to reference points on the leg. So let's say, for instance, the patient had a bullet wound on the upper leg. We could say that that bullet wound is superior to the knee. So they're in reference point depending on what is being referenced. This is one of the reasons why it's very important to be very specific in medical documentation to refer to where a particular symptom or lesion or whatever it is that is being referred to is on the body, whether it's the right, the left, the posterior, the anterior, the medial, the lateral, or the superior or inferior. Okay, in this next section, we're going to talk about abbreviations. Now, there's certain rules regarding abbreviations. We need to be careful about abbreviations. Always remember, when referring to abbreviations, whether you're reading it or you're about to write one, always refer to the context in which you're reading that abbreviation or about to write that abbreviation. And we'll talk about that a little bit more as we go through this. We're also going to talk about some abbreviations that really should not be used because of the tendency or the risk of being misinterpreted. Well, let's talk about the use of abbreviations. Abbreviations are frequently used in medical documentation, and as a healthcare professional, you will be expected to be familiar with the commonly used ones. However, you want to be careful to note the abbreviations that are no longer approved by the Joint Commission due to the fact that they can easily be mistaken for another word. Please refer to the document 1A, which will be in the download section, for a list of abbreviations. For maximum benefit, I would suggest to please create a set of flashcards, as I mentioned earlier in earlier lessons, and practice these on a daily basis. You may also purchase a set of pre-printed flashcards with abbreviations already printed on them. However, for maximum benefit, I would suggest you create your own because you actually do help to remember them by the act of writing them, saying them, seeing them, and then practicing with them. You may also choose to use a medical terminology flashcard app on your iPad, tablet, or smartphone. But you can also use PowerPoint as flashcards. Simply create slides with your words and definitions. And then you could practice these using the PowerPoint slideshow app or slideshow feature. Now, the Joint Commission has determined that there are some abbreviations that should no longer be used due to the fact that they may be mistaken for another word. These can be especially dangerous on prescriptions and medical orders. For example, QD can be mistaken as QID. QD means once a day, QID means 4 times a day. So if they're referring to a medication, taking it 4 times a day when it should be prescribed once a day could be quite dangerous. This could be dangerous as a dosage mistake, but it could also be dangerous in the medical legal aspect of it as well. On this slide, we're showing some of the do not use lists. There actually are many more, but these are some that you might want to take note of that should no longer be used in medical documentation. During the course of your career, you're going to come upon many different types of specialties that treat patients. Well, as a healthcare professional, it's important for you to not only become familiar with the one that you are working in, but also the ones associated with your field, and also those that are associated with those fields. Included in the downloads is document M1B, which is a list of physicians and different types of surgeons and those types of specialties. Again, I recommend making flashcards for these specialties and practicing them and getting to know them and learning them so that they become second nature to your language. Okay, well, let's get down to the very basics of the body. Atoms to cells. Atoms are the smallest, most basic chemical unit of the body. Atoms form together molecules. They're grouped together and they form molecules such as sugars, waters, and proteins. Together, those molecules form organelles, such as mitochondria, nucleus, and the ribosome. The organelles form cells, such as a nerve cell, an epithelial cell, or a muscle cell. And again, in this diagram, we see the difference. Molecules form the atoms form the molecules form organelles, and the organelles form cells. From atoms to organism, in this picture you could see atoms form molecules, form organelles, form cells, cells form tissues, tissues form organs, organs form organ systems together create an organism, such as the human body. Structural levels. Well, again, let's talk about these structural levels. The body is a single organism constructed of the following smaller units. Cells are organizations of various chemicals. Tissues are organizations of similar cells. Organs are organizations of different kinds of tissues. Systems are organizations of many different types of organs. Now we're going to go back to biology here and learn about the cell. There's 3 main parts of the cell. There's the plasma membrane, the cytoplasm, and the nucleus. And if you can see from this diagram, this is a typical type of cell. A cell in it of itself is quite an extensive creation. It actually is more complex than an interworkings of a metropolis type of city. The plasma membrane encloses the cytoplasm and forms the outer boundary of the cell. The cytoplasm is the internal living material of the cell, and it contains the organelles, which means little organs, which are the functional units of the cell. The nucleus is the control center of the cell. Chromosomes are found within the nucleus of the cell and carry the genes responsible for determining the heredity or the hereditary characteristics. There are 46 chromosomes in all human cells. Chromosomes are long, coiled molecules of DNA. Think of DNA or think of chromosomes as the informational program that determines what each cell in the body does and how each cell is organized and how those cells organize to create tissues and how those tissues are formed to create organs. Tissues. There are 4 main types of tissues. There's epithelial cells, which form the body's glands, cover the surface of the body, and lines the cavities. There's connective tissue. These form the supporting structures such as bone, fibrous tissue found in tendons and ligaments, adipose, which is fat, collagen, cartilage, and yes, blood. Next we have muscle tissue, as in the three types of muscles. There's the skeletal muscles, which are the voluntary muscles that control the skeletal system. There's the smooth muscles of the organs, which are non-voluntary and are responsible for such things as the blood flow through the veins and arteries, the digestive system, and other organ systems. And then there's the cardiac muscles, which are found only in the heart and responsible for the heartbeat. Next, we have nervous tissue, such as brain, spinal cord, and the peripheral nerves. The next level up are organs. These are made up of two or more types of tissue that work together to perform a specific body function. An example of an organ would be heart, stomach, brain, liver, or reproductive organs. The organs work together, one or more organs working together to perform a vital function creates an organ system. An example of this would be the digestive system, which contains the stomach, liver, pancreas, and intestines. All these work together to perform the function of converting food to energy. And we'll talk more about that when we get into the digestive system. One term I want you to become familiar with is called homeostasis. Homeostasis is the process of maintaining the relative balanced condition in the body. And the body is programmed to try to do its best to maintain homeostasis. Now, in order to maintain this homeostasis, the body uses two types of control systems. There's the negative feedback loop and the positive feedback loop. A negative feedback loop is similar to a thermostat system in your home. The body senses an unbalance, and so it performs a function to maintain that balance. A positive feedback loop is less common. It's a temporary change in the body's normal condition. Childbirth is one example. Childbirth causes contractions of the uterus in order for the fetus to be expelled outside of the body. So this is a temporary condition. The body is called on to perform a function that it's not normally called to function. Okay, well, let's summarize what we talked about today. We talked about medical terminology as being esteemed skill, and it takes time and effort to develop. We want you to use your flashcards daily. We talked about directional terms and the importance of understanding these directional terms. We also talked about the body cavities, the dorsal cavity and the ventral cavity, and what's contained in each one of these cavities. We talked about abbreviations and the use of those abbreviations, when we can and when we should not use abbreviations. We talked about the different levels of structure in the body, such as atoms, cells, tissues, organs, and organ systems. We talked about homeostasis, what homeostasis means. It's the body's attempt to maintain a level of balance. We talked about a negative feedback loop and a positive feedback loop and what these two mean. In our next lesson, we're going to talk about the integumentary system and the medical terminology used to define diseases, processes, and portions of the integumentary system. My name is Carol Peugeot. This is Innovate Training, and we'll see you next lesson.